The guidelines on how and when to treat certain cancers change frequently, often leaving some patients confused about their course of treatment. In tonight's Real Men Wear Gowns, Eyewitness News reporter Jeremy Baker introduces us to one man diagnosed with prostate cancer who has managed to avoid chemotherapy and surgery by taking control of his own health.
73-year-old Denny Richards had been keeping an eye on his PSA for a while, but last year things changed.
My PSA levels took a dramatic step up, and it was time for the biopsy, and that's when I started looking for a urologist and found Dr. Liss.
Because it was a low-grade prostate cancer, they decided instead of radiation or removal of the prostate, active surveillance was the best option.
You don't need to be treated for all prostate cancers. It's the low-risk cancers we tend to not treat now when we follow.
As it is right now, from my exam, or results from the biopsy, he kind of implied that I would probably die of something else than prostate cancer. It's slow growing.
Richards has even been able to lower his PSA by managing his diet by limiting his folate intake in a clinical trial.
Your PSA did slowly come down and seems to be under control. We don't need to do any more procedures, and we can keep following the PSA for now.
Richards says all men need to stay on top of their health to catch illnesses like this early.
Every year on my birthday, I have a physical exam, and it's a birthday present for myself.
Richards wore that gown and caught cancer before it caught him off guard.
I encourage everybody, go. This is one of the most easiest cancers to cure.
Jeremy Baker, KENS 5 Eyewitness News.
For more men's health information, call 210-358-3045. You can also find the rest of our Real Men Wear Gown stories by going to wearthegown.com.